नमस्कार आणि येवकार तुमकां आयच्या खाशेल्या कार्यावळीक. बरेचदा आमी म्हणटा की आमच्या फाटल्यान कोणतरी हात धुवन पडटा आणि फाटले जर 6-7 महिने 8 महिने जर पळयत जाल्यार एक गोष्ट जी आमच्या फाटली हात धुवन पडल्या ती म्हळ्यार कोरोना व्हायरस. ताका एज लागना, ताका कास्ट, क्रीड, रिलिजन, जॉग्राफी कांयच लागना. इट स्टार्टेड विथ फ्रॉम चायना, बट आयज पुराय ग्लोब ताच्या अंडर आसा आणि आमी सगळे जाण भियेता. बट when this pandemic started, initially WHO एक डायरेक्टिव्ह काढली की you have to wash your hands regularly every 2 hours. So आयज coincidentally or incidentally is global hand washing day आणि आयच्या निमतान आमच्या बरोबर दोन असे गेस्ट आसा जे ह्या विशयाचेर ह्या दिसाचेर काही आमकां आनी महत्वाची माहिती दितले. ते म्हळ्यार पयली सुवातेर आसा आमच्या बरोबर डॉक्टर इरा अल्मेडा, जे आसा मेंबर ऑफ इंडियन मेडिकल असोसिएशन गोवा. तसेच तुमच्या बरोबर जुळटा स्मिता आमोणकर, मॅनेजर क्वालिटी कंट्रोल एट लुपिन गोवा. हांव तुमच्या दोगांचें स्वागत करता. डॉक्टर, इफ यू कॅन जस्ट ओपन द शो बिकॉज इट इज ग्लोबल हँड वॉशिंग डे and we would like to start with the doctor's advice first.
Okay, this Global Hand Washing Day was started by the Global Hand Washing Initiative in the year 2008. And the UN Assembly appointed this day, October 15th, as Global Hand Washing Day. Now, the question is, why do we need a day like this? The reason is that it serves as a yearly reminder to us so that we create a culture of hand washing.
Okay.
It also is a chance to put a spotlight on various countries and what are their what are their hand washing facilities. And besides that, it helps us to every year talk about the benefits of hand washing.
Okay.
Now, really, this hand washing thing had started really centuries ago. You know, in 2 centuries ago, that's in the mid 1900s, there was a doctor called Dr. Samuel Weiss, and he's said to be the father of hand hygiene. In fact, this year's theme is hand hygiene for all. Now, what Dr. Samuel had done is Samuel Weiss, really. What he had done was he just took a bowl of water, he put some disinfectant in it, and he put it in one of the 3 wards where there was a high risk of puerperal sepsis, which is infection after childbirth.
Yeah.
And what he found was in the ward where he had this hand hygiene put in, the risk of dying from puerperal sepsis, that is infection after childbirth, was 3 times less. And right through the centuries, we have now realized the importance of hand hygiene, and more so now during this COVID epidemic.
Okay, that's a great way to start. We have Smita Amonkar, Manager Quality Control Lupin. Welcome to the show, madam.
Well, thank you very much.
Okay, just to start, we've just had opening remarks from Doctor. And what I would like to ask you, Smita, is when it comes to communication, when it comes to awareness, is it really important to have specific days like this to, encourage hand washing thing?
See, for years together, we have been knowing that we need to wash hands and all. पण वर्सा आमकां चड महत्वाचें समजलां की हात धुवप हें कितलें गरजेचें आसा तें. कोविड पॅन्डेमिक जो आमकां जाला सद्या गोंयांत, फूल जगभर आमी पळयता की लोक तातूंत मरण पावतात, तेन्ना हात धुवप हें कितलें गरजेचें तें आमकां कळना. सो असले दीस मनोवप सामकें इम्पॉर्टंट आसा. तर लुपीन पळय आमची कंपनी आसा, मेन ध्येय आसा की आमी लायफ थ्रेटनिंग डिसिजा पासून लोकांक वाचोवचे आनी ताचे खातीर सवायांतले सवाय भितर आमी सादारण मनशांक वखदां हाचेर आमी काम करता. प्लस आमचो पळय एक ब्रँड आसा लुपी सेफ, तातूंत आमी लुपीन हँड सॅनिटायझर तशेंच अल्कोहोल वायप्स आमी मॅन्युफॅक्चर करतात आनी हे WHO रेकमेंडेशन आसा हाका. सो हे वापरप गरजेचें हें आमी अवेअरनेस करूंक सोदता, गोंयानूच न्ही तर भायरूय बी. आनी दुसरी गजाल म्हळ्यार असले दीस म्हणून आमी लोकांक याद करूंक सोदता की तुमी अशे हात धुवप ही दिस इज सच अ सिंपल टास्क एक्चुअली, हँड वॉशिंग ही सोपी गजाल आसा, पूण ही खूब गरजेची आसा आनी इट कॅन सेव लायव्स.
ओके, Doctor, if I can ask you, it's a just Smitan म्हटलं की it's a very simple thing, but आम्ही खूप आळस करता, we don't follow this kind of special things, I remember when I was in school, there was the teachers would tell us, our parents would tell us, but every time we would go out, or every time we would come from playgrounds, our parents would ask us, हात पाय धुवून भितर सर घरात. But over this course of time, I think we've been lazy, complacent, and we don't follow that thing. How important and how difficult it is to convince people, whether it is a student, whether it is a kid, whether it is an adult. How would you respond?
I don't think it's really difficult to convince people of its
Yeah.
importance because during this COVID epidemic, we have
Hmm.
realized that if you do hand washing
Hmm.
well, and I'll tell
Hmm.
you how you really do that,
Hmm. Hmm.
it decreases your chance of getting COVID by as much as
Hmm.
36%.
Hmm.
Other areas being mask, using a mask and spacing.
Hmm.
But what we have realized is that if you hand wash, and that's exactly
Hmm.
what your parents and our teachers have been telling you,
Hmm.
you have a decreased risk of infections.
Hmm. Hmm.
And these infections are diarrhea, respiratory infections, outbreak infections like
Hmm. Hmm.
cholera, Ebola,
Hmm.
SARS,
Hmm.
MERS, COVID
Yeah.
19, and even hepatitis A and E.
Hmm.
Also, when we practice hand washing, it's
Yeah.
keeping, now we have realized more than ever, it's keeping the health provider safe.
Hmm. Hmm.
It's also not allowing the health provider to take the infection from patient to patient. So it's
Hmm.
keeping the patient safe.
Hmm.
But how you do health hand washing is very important.
Hmm.
And there are, as recommended by the WHO,
Hmm.
6 steps of hand washing,
Hmm.
where when you use the soap,
Hmm.
you use palm to palm, then you
Hmm.
use the back of your hands, you
Hmm.
interlock,
Hmm.
and then you do the nails,
Nails.
you do the thumbs,
Hmm.
and last you do the wrist.
Hmm.
Now, doing all these 6 steps of hand washing should not
Hmm.
be done in 5 seconds. It has to
Hmm.
be done at a minimum of 30 seconds or
Okay.
more. You
Okay.
could, if you don't have a timer there, you could also sing Happy Birthday twice. Okay. Or
Okay.
any other of your favorite rhymes after you've
Yeah.
timed it.
Yeah.
Now, besides using soap and water, a
Hmm.
lot of people use alcohol rubs because that's
Hmm.
easy to
Hmm.
carry, or an alcoholic solution.
Hmm.
But it's important that we don't use it like we use scent
Hmm.
and think that we are safe.
Hmm.
You
Hmm.
need to take enough of alcohol rub in the well of your palm and do
Hmm.
the same 6 steps of hand washing, but much quicker. You could take 15 to 20 seconds.
Okay.
Now, for healthcare providers, we also have moments of health hand washing.
Hmm.
These are
Okay.
before you see a patient, before you do a procedure for the
Hmm.
patient,
Hmm.
after you have seen the patient after the procedure, if you're dealing
Hmm.
with body fluids,
Hmm.
or if you touch the patient's surroundings like handrails, tubings,
Okay.
sheets. So
Okay.
there are 5 moments of hand washing for the healthcare provider.
Okay.
Besides that, you also have moments for the lay person before
Hmm.
you have your food,
Hmm.
where before and after you go to the toilet.
Hmm.
When you are you come from outside. So
Hmm.
WHO says that if you wash your hands 6 to 7 times a day,
Hmm.
you're likely to decrease the risk of
Hmm.
getting a COVID-19. The other point is accessibility. Water supply? Are there
Hmm.
enough health washing facilities at various points?
Hmm.
And we need to, is there the availability of soap?
Hmm.
So these are the points that we need to look into. Maybe
Hmm.
we, with COVID-19, now we have places like transport hubs, like bus stops, railway
Hmm.
stations,
Hmm.
airports, and seaports, where we should have health washing facilities, as well as marketplaces, religious places, healthcare facilities,
Hmm.
and schools for the general public. This should be available.
Okay.
With COVID-19 also, some innovations should be in that you have a no-touch technique,
Hmm.
and you don't touch the soap or you don't touch the tap. And these are the ways in which we can make hand washing effective.
Smita, if you can speak on the CSR activity that you've been doing, because I believe hand washing is a very important thing which is engraved. Obviously, घराकडच्यान ती सुरुवात जाता, त्याच्यानंतर स्कूलांनी ताजेर मातसो emphasis जाता. But आम्ही, as we grow along, we forget. In terms of your company, in terms of corporate social responsibility, and you work with a lot of NGOs, you work with a lot of schools. How have you been spearheading this mission, this initiative? in Goa specifically?
First thing I would like to say is that we have this. First of all, we have started this Loopy Sef brand,
Yeah.
under which we have two products. One
Hmm.
is 70% isopropyl alcohol wipes and 70% alcohol sanitizer.
Hmm.
तर हे दोन्ही जे आमचे पळय सॅनिटायझर्स आसा न्ही ते आमी अवेलेबल केल्या. प्लस आमी थ्रू रिसेंटली आमचे IPL लॉन्च जाल्ले. सो IPLान आमी चेन्नई सुपर किंग्साक वी वर द ऑफिशियल हँड सॅनिटायझर. सो हातूंतल्यान आमी लोकां कडेन ही मेसेज पावोवंक सोदता की हँड सॅनिटायझर कितले म्हत्वाचें आसा तें.
Okay. But in terms of CSR activities, स्कूलांतल्यान तुम्ही आता हे नवे तुमचो product जो आयला, obviously you are just entering a new market altogether, but you have been always there supporting. This obviously hand washing is a very important thing in everybody's life. So I think you have been taking initiatives like this in school levels and other activities that you do at CSR level.
At school level also we go and we have distributed hand washes and stands in different parts of India. And CSR activities आमच्यो continuous चालूच असता in terms of schools, मागीर old age आणि हांगाय बी बाकीचे कडेन बी.
I would like to ask another question, Dr. Ira, is any impact, like you have said, this celebration of this day started in 2008. Over this course of time, has this day made any impact at state or maybe at national level also? And considering this day and maybe another future course of time, because the times we are in is quite different for the last 6, 7, 8 months that we have lived is way different than what has been in the past. What is that you'd like to suggest from here on that every whether it is government or whether it is institutions, all these people should follow to make it compulsion of washing your hands every single day, every moment?
Definitely the impact we have seen at our own local level. I'm a pediatrician. I work at the local district hospital Hospicio, and we have seen that the normal monsoon maladies, where every year we do focus on hand washing and which can be prevented by hand washing, like diarrhea, respiratory infections, and hepatitis A and E, have definitely come down. Normally, we would see in an OPD 100 to 150 patients during the monsoon, but now we're seeing just 10 to 15. And we know that patients are not sick. That's why they're not coming. And we think it is because of so many months of good hand washing, besides other things like staying at home and not going to schools, etc. Also, when we started, we used to have a flu OPD. The numbers that come to the flu OPD are now much less as when we started in May and June. So probably hand washing has contributed to this. We need to now that we know it's important, we need to have create the culture so it becomes second nature to us to keep on washing our hands, and we need to sustain this and make it universally possible for everybody to hand wash.
Okay, that's an interesting thing, and I think the association that you are part of, and obviously the government machinery and the times, more importantly, I always repeat it again and again, the times that we are in has taught us a lot that we have maybe forgotten or maybe we have been lethargic to practice. Okay, one more thing if I can ask you is obviously तुम्ही म्हटलं की you have entered into sanitization space, that is Lupin safe या product what made you enter this market? Was it pandemic? Was it demand, or was this always on your list to enter this space?
At Lupin, we are always committed to fight the life-threatening diseases. So कोविड पॅन्डेमीक जालें न्ही तेन्ना आमी पळयलें की देश सगळो आमचो कसो झुजता ह्या COVID-19 पॅन्डेमिकान आनी कितले लोक मरण पावले. गोंयांतच तुमी पळयात ऑलरेडी कितले लोक मरण पावल्यात ते. सो वी फाउंड दॅट इट इज आवर रिस्पॉन्सिबिलिटी, सोशल रिस्पॉन्सिबिलिटी टू सपोर्ट द नेशन, and it is our duty to participate in this event and help the nation. So आमचे मेन एम म्हणजे जे लोक कोविड पेशंट जाय आसा किंवा मागीर बाकीचे कोणी जे हेल्थ वर्कर्स आसा तांकां इजिली अवेलेबल मेडिसिन्स विच आर अफोर्डेबल हे करचें, प्लस एक ड्रायव्ह करचो अबाउट सॅनिटेशन. सो दॅट्स वाय वी आर सेलिब्रेटिंग दिस वर्ल्ड हँड वॉशिंग डे टुडे.
Just before I end the show, what would be your take-home message to all the viewers that are watching this particular special broadcast on this special day?
It's cheap, it's free, relatively. I mean, you need water and soap. That's not an expensive thing. And you have to do it frequently. You have to do it properly and spread the word.
एक म्हणजे हांव तुमकां सांगता की तुमी प्रत्येक जाण आपापल्या जिवाची काळजी घेयात. जेन्ना तुमी भायर सरतात तेन्ना तुमी मास्क घालात. मास्क घालप म्हणजे तोंड आनी नाक सारके कवर जावपाक जाय. बाजारांत सद्या पळय जे हँड सॅनिटायझर्स अवेलेबल आसा न्ही ते 50% it is understood in a study that 50% are fake and they are of substandard quality. So it is important that whatever sanitizers तुम्ही वापरतात पळय ताका रेकमेंडेशन आसपाक जाय. कित्याक हे अल्कोहोल जे आसा ते 70% पासून कमी असलें जाल्यार इट इज नॉट इफेक्टिव्ह इन किलिंग द मायक्रोब्स. Okay, so you see that you buy those sanitizers which are from trusted brands and they are recommended by regulatory authorities. दुसरे म्हणजे तुम्ही जेन्ना जेन्ना घरान भितर सरतात 7 ते 10 फावटी हात धुयात, शाबू धुयात आणि भायर जर तुम्ही वतात थंय जर तुमकां शाबू आनी उदक मेळना जाल्यार यूज दीस हँड सॅनिटायझर्स. आणि चवथी खबर म्हणजे तुम्ही घरच्यांक ल्हान तशेंच जाणट्यांक तुम्ही समजायात की हे डिसिजाचे कशें जावंक शकता आणि हात धुवप हे कितलें महत्वाचें तें.
Hand washing is a very important part of our daily practice, and it should not be celebrated on one particular day, that is today. It should be practiced every single day and every moment. And if you have seen the entire program, you know what movements are, what is the frequency, what is the right way to wash your hands, what is the time limit that it should happen. It should be always around 30 seconds, right, doctor?
Yes, minimum of 30 seconds.
Minimum of 30 seconds. And you can always recite a nursery rhyme. You can always sing happy birthday. You can always sing your favorite song. So make it entertaining and obviously your daily practice. Smita Amonkar, who heads Manager Quality Control at Lupin, and Dr. Ira Almeida, member of the Indian Medical Association Goa. Thank you both of you very much for joining on this special broadcast and making this program very special to all our viewers.
Thank you. It was a pleasure to be on your show too.
Thank you very much.
तुम्ही पळयत रावात प्रुडंट. आणि जशें आमी पॅन्डेमीक सुरू जालें तेन्नाच्यान एक व्हिडिओ सर्क्युलेट केलो जो WHO चे डायरेक्शन्स आसले, हाऊ टू वॉश युअर हँड्स अँड वॉट इज द फ्रिक्वेन्सी. तो आवर्जून पळयात. आणि ऑब्वियसली फाटले जशें डॉक्टरांनी म्हटलें की बाकीचे जे केसीस आसा, थंडीचे म्हणा किंवा फ्लूचे केसीस आसा ते कमी जाल्या. ऑब्वियसली ह्या 6-7-8 म्हयन्यान बरेचशे गोष्टी जाल्यो, नेगेटिव्ह म्हणा किंवा पॉझिटिव्ह. नेगेटिव्ह वेरी द इकॉनॉमी इज इम्पॅक्टेड, लायफ्स आर इम्पॅक्टेड. बट ह्या हितूंतल्यान खंय तरी आमकां एक सिल्वर लायनींग पळोवपाक मेळटा, दॅट इज वी हॅव स्टार्टेड प्रॅक्टिसिंग हँड वॉशिंग ऑन अ रेग्युलर बेसीस अँड वी हॅव बीन अवे from a lot of diseases that we would otherwise inherit during this monsoon or during this period. Thank you very much. तुम्ही पळयत रावात हो प्रोग्राम. तसेच बाकीचे प्रोग्राम जे आम्ही करता. घराकडे रावात, सेफ रावात. जर इम्पॉर्टंट असा जाल्यारूच भायर सरात. आणि मोर इम्पॉर्टंटली सोशल डिस्टन्सिंग, wearing of mask and washing your hand is the most important thing that I would like to conclude this program on. Thank you very much.